Autoimmune disease can turn a vibrant life into a daily grind. Just getting through the day is a challenge and it feels like there is no end in sight. But there is light at the end of the tunnel. In this video, I'll share how reversing autoimmune disease is actually possible. Autoimmune disease is at an all-time high these days, around 24 million Americans, and those are just the ones who have been diagnosed. Autoimmune conditions can cause a wide variety of symptoms. Many times, these conditions slip under the radar because many of the symptoms are often attributed to normal aging. Unfortunately, testing for autoimmunity and antibodies isn't standard practice. I come from an internal medicine background, and I can tell you from my primary care days that your PCP may not always have time to dig deeper and run comprehensive testing on every patient. Usually, a standard workup that your insurance approves is done. And when this standard testing comes back okay, patients are often told that they are fine and there is really nothing to worry about. But it's not fine. In fact, having some immune reactivity or full-blown autoimmune disease impacts your whole body. It impacts your tissues, can compromise your thyroid function, and can even cause chronic fatigue, hair loss, joint pain, rashes, brain fog, and the list goes on. In order to successfully reverse autoimmunity, we have to calm down the cascade of inflammation that starts in the body. This begins with nutrition. We start with an anti-inflammatory diet and remove the big, commonly known triggers like sugar, dairy, gluten, and grains. But we often find that there may also be more specific intolerances, so we may test for those as well. So the first thing to do if you suspect you have an autoimmune disease is to get the proper testing. We not only measure various antibody levels, but we also look at possible root causes that could have triggered autoimmunity in the first place. A big player in the development of autoimmune disease is actually the health of your digestive tract. Research shows that autoimmunity may actually begin in the digestive tract. Something causes damage to the lining of the digestive tract, and food that normally just passes through the digestive tract now starts getting into your bloodstream. This triggers the immune system through a mechanism called molecular mimicry. We also have to do testing to see what's out of balance and then heal the gut. This means clearing out any infections and bacterial and fungal overgrowth and imbalances, as well as repairing the gut lining. And another big reason or underlying triggers for autoimmune disease is toxicity, including mold, heavy metals, and even other environmental toxins. We do precise testing to see if there could be some toxic buildup in your body. We may look for mold, heavy metals, other environmental toxins, and also look at your genetics to evaluate your risk of developing autoimmunity and your ability to handle these environmental toxins. We work on improving how you handle toxins as well as improving your ability to detox. Many people don't realize that our environment is more toxic than ever. They may not know that they have been exposed and continue to carry toxins in their bodies. These are stored in organs and fat tissue. In fact, I find that majority of my autoimmune patients are dealing with some kind of toxic overload that needs to be cleared so they can heal. In my practice, we look at the many areas needed to reverse autoimmune illness long term, from diet to stress to gut health and toxins, nutrient deficiencies, and your genetics. Once we're able to do the correct testing and mentor patients on how to change lifestyle factors, many of these symptoms start to decrease right away. When we help patients do the correct type of detox, they're well on their way to reversing their autoimmune condition for good. To go deeper on the topic of autoimmune disease, sign up for a free 15-minute discovery call where we can discuss your specific situation. Simply click the button below this video.